Hello and welcome to Journalist Hangout. I am Esther Makwariola. Today on the program, Inspector General of Police deploys 2 DIGs, 5 AIGs and 14 Commissioners of Police for Anambra governorship election. Bandits impose levies on Sokoto communities, issue ultimatum for payment. And later on the show, Kebbi State Governor's wife calls for screening services at the primary healthcare centers to tackle breast and cervical cancer. I will be hanging out with Babajide Kolade Otitoju and Sam Ibere. Journalist Hangout starts now. Now, the drumbeats of war that have sounded loud in Anambra State necessitated a drastic security measure to ensure peaceful conduct of the November 6th governorship election in the state. In response to the escalating security situation, the Inspector General of Police, Usman Alkali Baba, has ordered deployment of strategic commanders to the state for effective security during the election. And they include the Deputy Inspector General of Police, Joseph Ebunike, who will coordinate the security arrangements, and he will be assisted by the DIG in charge of operations, Zaki Ahmed. And 5 Assistant Inspectors General of Police, AIGs, 14 Commissioners of Police, 31 Deputy Commissioners of Police and 48 Assistant Commissioners of Police, and they are to coordinate operations in the 3 senatorial districts, 21 local government areas and the 5,720 polling units in the state. Well, let's hear from the National Security Advisor, Baba Gana Munguno, and the Inspector General, who assured Anambra people of their safety on election day.
Primarily, our intentions, our aspirations are to see that the elections do not result in anything that is unwanted, any bloodshed, any violence, intimidation, coercion, or even terrorizing the people of Anambra State. It is their fundamental right to vote and choose whoever they want to choose as their governor. They should not be denied that right.
Security is a civil responsibility that we will provide to the people of Anambra to come out and exercise their franchise. And we hope we will do that with all sense of responsibility. And we also urge the people of Anambra to come out in mass and exercise their franchise.
Now, Babajide, in addition to this deployment of about 33,000 police personnel in Anambra State that is sent to monitor the electoral process, what do you make of this arrangement?
I think that the police management is doing its best to get that message across that it is determined to secure Anambra State during this election. Remember, the IG had earlier announced the deployment of more than 31,000 policemen for the election, police personnel, that's men and women, for the election. So now the job of these senior officers is to coordinate activities, ensure that they provide direction for the 31,000 plus policemen and women that will be on ground. It's not enough to simply pour policemen into Anambra State. They have to be coordinated. There has to be some directing minds that will ensure that, okay, this is where they go, this is how they conduct themselves, and they also have to be supervised, thoroughly supervised, because the job of the policeman is not to support a particular party. Your job is to provide security, maintain the kind of presence that constitutes some form of deterrence to people who would like to foment trouble on election day. They are not even supposed to get too close to the polling centers. No, that one is even against the Electoral Act. They can't get too close to the polling centers to influence what goes on at the polling centers. They just have to be around the area, provide security. Now, this kind of story serves all kinds of purposes. Even the people who want to foment trouble will know the extent to which we are planning to deploy as a country, because even the army will also be physically present. The Air Force, maybe special forces, the Air Force will also be used, and I know too that the civil defense operatives will also be involved. Anambra may turn out to be the most militarized off-season election in our history. And if that happens to be the case, it will not be shocking to any of us, given some of what we have seen in the last few weeks in Anambra State, campaign grounds being stormed in Ihiala, and people being killed for the offense of being present at the rally of one of the major parties in the election. Only ABGA is campaigning publicly in Anambra State. I've never seen that kind of situation. Other parties are even relocating campaigns to outside of the state. And even ABGA that has mustered the courage to campaign, they've also come under some attack. The candidate of ABGA lost 3 of his policemen when they attacked him some months back. And then at the rally in Hiala, scores of people were killed. So the only way people can feel, I heard the NSA saying people should come out en masse. That's not going to happen in this kind of election. All the telltale signs are there that you are not going to have people come out en masse. There is even no record of people coming out en masse to vote in Nigeria. That's completely against the grain for people to come out en masse. They don't come out en masse to vote in our country. Maybe it's because people don't fully trust the political class, you know, and then even confidence in the process itself has been waning over time. By the time INEC fully commit to organizing credible elections, the fidelity of which we can hold high as Nigerians, maybe more people will begin to show interest. You hear stories that, oh, the election has been decided. No, we are not going to bother ourselves. So it's not a shock that we don't get large turnout. Yes, that won't happen. That wish of the NSA won't happen. What we want to see is let people be able to come out and vote peacefully.
Right.
And we can achieve that if our security forces are on the streets and people can see them. They will have some confidence that, look, even if I come out,
I'm
protected. That's what they should be doing. And as I said yesterday, we have an air wing of the police that needs to be used effectively this time. Let's have their aircraft, their helicopters patrolling the area on election day. Patrolling the area, monitoring what's going on. Not aircraft firing tear gas at voters, aircraft patrolling, so that people can know that on land and on air there is some measure of protection for them. If we can guarantee that people will come out and vote.
Right. Now, Sam, there are concerns that this huge police presence, as it were, will further instigate violence in the southeast and more or less affect the outcome of the elections. How do you see this? What do you make of this?
Well, I think the concern is real, and that would happen if the security operatives who have been assigned to that territory do not apply themselves strictly, to the rules of engagement. If they set out to do their job, I don't see, such such fears coming to pass. But there's a bigger worry, and that worry is that given our past history, we have always had a tendency of security operatives who have been assigned to help manage the conduct of our elections, turning around to take sides. And if that is the case, or if we get to witness that in the course of the November 6 elections in Anambra State, then we'll have a huge trouble on our hands. So the advice we want to put out there is that we want to encourage our policemen and other security operatives who will be assigned to Anambra State to conduct themselves very well, live by the rules of engagement, and then we wouldn't have too much concerns. Already there's a lot of there's so much tension. Even the guarantees that we have had listening to politicians in Anambra State still don't give us so much hope. I've listened to the Commissioner for Information, and other senior government officials, tell Nigerians that some kind of conversation is going on between politicians in the states and members of the proscribed indigenous people of Biafra. We hope something tangible come out of these conversations. Only then, and only if we have such public statement put out by IPOB, because this let's admit it, IPOB has become a very influential not just group but a movement, and if the politicians in that state can get them to speak out concerning the November 6 elections, that would do us a lot of good. The probability that will be done could be very slim, but we know that some of these things can be resolved at the political level. So we must admit that there is indeed serious tension in that area. Just like as Jide has said, we just hope the election, the gubernatorial election in Anambra turns out peaceful. Well, there are concerns that we could have a big problem in our hands. The optics in terms of what government has promised to do is there. Yes, the surge in terms of numbers, over 33,000 men and all that, will be good for you and I who are listening. But what you probably will find at the end of the day is that most of these people will end up probably in the towns where you and I know, but in the rural areas, you won't get to see these people on ground. And that wouldn't give voters the confidence to want to come out and cast their votes. So the fear of voter apathy is real, and that is because the trend in the last couple of weeks and months suggests that it wouldn't be safe for anyone to take that kind of a risk in an environment where even the government has come to accept that every Monday you sit at home and that children can go to school on Sundays and all that. And even at that, you still have warnings that people should not, people should keep the Sabbath day holy. I've had such said. So even those who are, making plans to get our children to go to school on weekends, the chances are, given what we hear, are indeed very, very, very slim. So for the optics, it's good the government has said that they will do this. But there are also worries that sometimes the numbers they promise don't get too materialized because it's all for the purpose of just budgeting. We hope that the number that has been promised will indeed be deployed to Anambra State, and that the officers so concerned will apply themselves to the task that they've been assigned to, and live by the rules of engagement.
Indeed. Babajide, now with what has been said so far, what will it take to secure a free and fair election in the southeast, in Anambra particularly, that seem to be largely under control by the separatist or by the illegal separatist group IPOB?
No, it's not under their control. It's just that they've managed to create a climate of fear in that state, and people are not taking chances. People are not taking chances. Even on Monday, some schools were open. in Anambra. Not that that everyone obeys the directive, but most people would not take chances. They would rather sit in their own hand. Civil disobedience is one of the big strategies that pressure groups use. IPOB as a group has used it effectively, and it is because they also enforce it and they won't mind to take lives in enforcing it. But what we have seen is IPOB says it has revoked the sit at home on Mondays, but cult groups and renegade groups are now taking it upon themselves to simply enforce a directive that IPOB that instituted it in the first place has since revoked. So it's painful. Most struggles usually get hijacked midway. Many struggles even consume their originators. We've seen now that even the struggle that Kanu began, some individuals are giving that struggle a bad name already. Some individuals have hijacked it, because if directive can come from Kanu himself, and some boys will take it upon themselves to simply behave like he has not even spoken, then something is wrong. The other day he was sending word that nobody should disrespect his lawyers. People have been abusing his lawyer, and he's saying, look, these lawyers are doing their best for me. I will not tolerate people insulting my lawyers. That's Kanu speaking. So in this case, as I said yesterday, I know that IPOB, the mainstream IPOB, because Nigerians now see every negative thing happening around there as instigated by IPOB. Yeah. That is not entirely true. IPOB, there are means of reaching IPOB, and there are prominent people in the East that can be used. People like the former governor, Ezife. IPOB still respects people like that. So we hope that reason will prevail, and we will be able to have this election, because the people must choose their leaders. They must choose their leader, and they must be allowed to choose their leaders.
Well, let's hope that things turned out for better for the people in the Southeast. Well, let's move on quickly to our next issue of discussion. Armed banditry in the Northwest has become a Frankenstein monster that is difficult to tame. Apart from killings and abductions by the bandits, they now impose levies on some hapless communities. In Sokoto State, for instance, daring bandits imposed levies ranging from 400,000 naira to 700,000 naira on some communities, and they also issued ultimatum on residents to pay the money before Friday or they will be attacked. And some residents have also been barred from their farms pending payment of the levies. Now, Babajide, according to a source of this story, people are already paying, because they have no other options, and they prefer to, well, pay and live in peace in their communities than rely on security agencies, as it were.
Yes.
How did we let this happen?
For so long, we did not deal decisively with these boys, and they've now even assumed that they are bigger than the state. This is what we are seeing. At the embryonic level, we should have crushed these boys. Right now, they have expanded their tentacles. They are mobile. As we've seen, some of our strategies, even in terms of the military campaign, are not working. Nigerians will recall that for the past 2 years, I've been saying that, look, if we want to deal decisively with these people, we must block their exit points from the contiguous states. But as we have seen, we didn't do that. So you have a situation in which there is some level of improvement in Zamfara, but the same bandits have moved into Sokoto now. We are now reading virtually every day now atrocities committed by bandits in Sokoto State. It was not like that before. It's easy to explain what has happened. That some bandit leaders have simply slipped into neighboring Sokoto State, and Sokoto borders Niger. You see the areas where they are active now, they are able to use the telco services of Niger Republic to call people to negotiate for ransom and all kinds of rubbish, because our strategy was not effective enough to block them from escaping. If you are hitting them, all of those states link one another. Kaduna, Katsina, Kebi, Niger, they link one another through vast forests. Kuyambana, Sububu forest, all of these forests, they link one another. Some of them stretch as far as Central African Republic. So the way to do it, block them from escaping, so that we know that the military campaign will be total and it will achieve realistic goals. Now, it's not new. This thing that they've gone there to do, they've already applied in Katsina, they've applied in Zamfara, True. They've applied in Niger. So when they get to a place new, they let you realize that, look, we are in charge now, and you live by our rules. The alternative is you won't be allowed to harvest, and we could even burn your village. That's what, you know how wicked bandits are. Sometimes when they attack a village and they kill people, they stay there to stop you from even retrieving the corpses of people. Ask anyone familiar with the idiosyncrasies of these guys. They won't even let you pick corpses, so that the humiliation of our people will be total. If you can't pick corpses of your loved ones for 5, 6, 1 week, you know what that means. So this is what they are doing to our people. When they were resisted in southern Kebi, those ones were not used to paying to access their farms. They slaughtered 88 in one day. So in the end, our people, in exchange for peace, will gladly say, okay, we pay. Look at what happened with Dogo Gide, one of the most notorious bandits in our country, who killed another bandit because that bandit went to some communities to kill people. He didn't do that because he liked those people. It was because he had already made peace with people of those communities. And as far as he's concerned, since he had made peace with those people, you dare not come and harass them and be killing people. So that's what we are seeing. So Dogo Gide, who is known to have kidnapped school kids, kidnapped all kinds of people, cannot be seen now as the poster boy of a nice bandit. No, he's not. He's not. It's just a case of, no, these ones, they've paid for me to protect them. You cannot then come and take their lives.
Okay, Sam, now, before we take this matter home, what do you make of this position and how the government has handled this situation so far? How can we nip this in the bud quickly?
Let me start from the very last point you made. Right. Nipping it in bud. I don't know what we're going to nip, because we already have, a monster on our hands. And we have repeatedly said so, right here on this forum. Almost every week that journalists have gathered here, more than 50% of the time, the issues that bother us have had to do with the crisis that we have in Nigeria in terms of security. So it's a very big challenge, no doubt about it. Some of us have dared to, insinuate that some of the states that we have in the northeast and in northwest, are indeed very close to being described as failed states. And we cannot be said to be sounding or to be alarmist. If you take Sokoto, for instance, out of 23 local governments, the last time I checked, about 14 of those local governments had bandits very active there. In Zamfara, of course, all of us know that Zamfara is the epicenter. In all of the 14 local governments, bandits are said to be very active. In Katsina, that has 34 local governments, bandits are said to be active in 13 local government areas. In Niger State, that has 25 local governments, bandits are said to be active in more than half.
Just goes on and on.
It just goes on. In fact, in Niger, the governor, as late as April, admitted that the Boko Haram group were controlling 5 local governments. I don't know how else you can describe, a national crisis. It's an emergency.
So what should be done?
What should be done is for the government to quicken its actions in terms of managing lives. That's the primary responsibility of government, right, to protect lives and property. Yes, we would admit that something is being done, but you can tell that the impact is not felt. The government seems to be overwhelmed.
Right.
And we need to act decisively about these things. And that's the point that is being made. There has to be a better strategy to managing it. I mean, sometimes we seem to have some kind of relief. And the next moment, the bandits head elsewhere. It just shows that there is a gap in terms of strategy. We've talked about things that need to be done. Jay has just talked about it here. But the question to ask is the government and indeed the military listening, or do they consider those of us who make submissions at this forum completely ignorant of what is happening? But these concerns are real.
All right.
The insecurity that is confronting the nation is one that we cannot just slip over anymore. And
Absolutely.
The government has to admit that things have to be done very quickly.
Well, let's leave it for now at this point of discussion. Many thanks for this insight so far. Let's quickly go on a quick break. We'll have more discussions on Journalist Hangout after this. Stay with us. Welcome back. You're still on to Journalist Hangout. Now, cancer of various types is still a menace to the society. Without known cure for cancer, experts are harping on early detection for effective management of the ailments. And to this end, wife of the Kebbi State Governor and founder of Medical Aid Cancer Foundation, Zainab Bagudu, called for provision of screening services at primary health care centers across the country for early detection of cancer. Now this, she said, will also increase cancer awareness at community level, since most Nigerians live in rural areas and lack access to basic care. Well, let's share this story with you before we go into our discussions.
Cancer remains a major leading health problem worldwide. Every year, an estimated 10 million cases are recorded globally, 6 million of which result to death. In Nigeria, it is estimated that 72,000 cancer deaths out of 102,000 cases diagnosed annually occur in a population of over 200 million people. A carnival-like atmosphere as men, women and children take part in this 5-kilometer awareness walk on cancer from Utako through the streets of Abuja. Participants drew the attention of many as they walked, sang and merry. The organizer, supported by her husband and other notable personalities, says support is needed from multinational organizations to increase awareness and bring fatalities to the barest minimum.
We also come together in such a large group to make a statement to the policymakers, to the government, to even the pharmaceuticals, to say that this many people are worried about cancer and we need to do something about it. By coming together, our voice is stronger.
In Kebi, we have an indigent fund that was, again, her pioneering work to mobilize money to support the indigent who are affected with cancer, which has led to, at the national level, adoption of a catastrophic cancer fund.
Aisha Umar is the Director of Clinical Services at the National Hospital in Abuja. She says 40% of cases handled at the hospital are cancer-related.
The problem is that they come late. Because of this, the outcome is not the way we expect.
Participants said the walk was eventful.
Now I'm feeling better. Yeah, I like it. I'm feeling better. But what I will advise is not only in Abuja. You understand? Let's go to the locality. local area, like state, local government.
Achieving less number of deaths from cancer is what awareness programs like the one that just ended hopes to achieve. But participants say while sensitization continues in urban centers, our rural areas should not be neglected in the drive to create adequate knowledge about the killer disease. Joke Adisa, TVC News, Abuja.
Well, let's discuss this very briefly now. Babajide, talking about cancer, we know that there's so much awareness, in town with regards to how we can detect this early and prevent, any disaster that may come out afterwards. But what's your take on the level of awareness, starting with the rural areas? Are people really aware of what cancer is and how one can really prevent it from getting that worse?
Certainly the awareness is not enough, and that's why we've got to praise the wife of the Kebbi State Governor, Dr. Zainab Shinkafi Bagudu, for the role that she's playing. Everyone needs to jump in. Everyone needs to play his part to ensure that we bring down the rate of fatalities from cancer. 72,000 cancer deaths in our country every year. That's huge. That's huge. And 102,000 new cases discovered every year. So out of the 6 million global deaths from cancer that we record each year, you can see that Nigeria plays its own part negatively. So we need to do a lot more by way of awareness and by way of even setting up those cancer screening centers so that people can discover the ailment early. Once we are able to do that, we'll be able to save a lot more lives.
So, in your own position, do you think we have enough cancer screening centers? I'm sure we are, lacking behind in that. But what can we do? What more can be done so that people get access to healthcare facilities that have these centers at their beck and call?
Investment. The government needs to invest more. We already have a situation where Nigerians are not getting, the best out of our healthcare system. So there are, shortfalls all over the place. So only investment, and that is why, this noble cause by the wife of the Kebi, governor, is one that should be commended. We need to have a lot more awareness. We need to get the authorities to, appreciate that, access, to early diagnosis is very important, in managing, the cancer scourge. Indeed, the cancer scourge is one that I can relate with. I lost my dad to prostate cancer, and it's a disease that kills rapidly, very expensive to manage, and that is why the government needs to commit a lot more resources into it. Thankfully, the world is experiencing a lot of advances, in the medical field. But it would take, early diagnosis for different forms of cancer, cervical, prostate, like I said, breast cancer, and all that. Once you are able to,
early detection.
Early detection, and then you can begin to manage them. My dad, like I said, had to live with it for almost a decade, and that was because we were able to detect it early. But then. Cancer is the sort that kills, in a way that you really can't explain, So it's good to see, advocacies of this kind, all over the place. We want to recommend that other, prominent Nigerians who are of means and of influence, should commit themselves, to activities like this. Right. That way, you have, many more people access in. Cancer care.
All right, now we understand we have the wife of Kebbi State Governor, Dr. Zainab Shinkafi Bagudu, and she joins us from our Abuja studio. Good to have you, ma'am, on the program this evening. So let's begin with this now. Medicaid Cancer Foundation champions is nationwide cancer awareness in our country. What prompted you now to focus on cancer, and what successes are currently being achieved?
Well, thank you very much for having me on the program. It's been a long fight against cancer, what prompted us was really the need when I started looking after, I'm a pediatrician by training, which means I look after little children. But as we all know, it's the mothers that bring children to the hospital. So when I was seeing my patients, the mothers would come with one issue or the other that is private and related to their, most of the time, breast, because as we know, breast cancer is the commonest cancer in Nigeria and indeed the world. So I was doing that, and gradually I got drawn into women's issues, this private issue about their breasts. And I realized that there was so little awareness. People didn't know, the women in particular didn't know what to do. They didn't know where to go. They didn't know how to seek for assistance, at what stage. This was even in an urban area. And so as I progressed in it, we would get drawn into more and more things, supporting treatment, screening, trying to diagnose earlier, trying to diagnose better, to get the right diagnosis. And of course, then we started venturing into policy advocacy, that is working with the government at different levels in the Kebbi state. We work with the Kebbi state government, the Ministry of Health, the Federal Ministry of Health, and internationally as well, globally, to try and seek better policies for cancer control. Have we made an impact? Yes, I believe that we have made an impact. And I believe that the more we do, the more people get aware and the more they want to know. Maybe when we started 13 years ago, our foundation would see about 10, 20 patients a month seeking for support. For us in low middle income countries and in Nigeria, particularly the area that I work in, the commonest need is support, financial support. Like Sam said earlier, cancer is very expensive. Anybody that has dealt with it or has come close to anybody dealing with it will tell you that it's not supported by our health insurance system. And so the greatest need that patients with it have is financial assistance. They need money to get to the hospitals that are far from where they are. We have less than 6 good functioning cancer centers in the country. They're expensive, and also even the chemotherapy and what you need to sustain life. So it can bankrupt even the well-to-do. So we have achieved a lot. Now, I was saying before, we would say about 10 patients. Now, on a monthly basis, we get requests upwards of 100 asking for financial support and different questions to do with cancer. In the 13 years, we have been able to impact over 60 million people in terms of directly reaching them and doing something through various means.
Now, we understand you are a pediatric consultant, and one of the most painful realities about cancer is the fact that it even afflicts little children with, like, brain tumor, for instance, leukemia, lymphoma, and others. Now, have you had to deal with this kind of situation? Are there things now parents can do in this regard?
Yes, like you say, pediatric cancer is a reality as well. But I'll first say the good thing about pediatric cancer is that it is 85 to 95% curable. However, that depends on which parts of the world you come from. The high-income countries can cure it because the drugs are available and detection is early, and the equipment to make the diagnosis and the system, like the primary health care centers we were talking about earlier, there's a good healthcare system that picks up cancers in children early. But if you come from a low middle income country like us, the cure rates or the prognosis of cure is between 25 to 45%, depending on where you come from, for all these reasons I've mentioned. So that is the downside of pediatric cancer in the tropics, or should I say in the low middle income countries. It is a curable cancer. It has a very good prognosis. Some of them are hereditary, some are due to toxins, but most of the time it is curable. We find lymphomas, leukemias, yes, we've come across quite a lot of them. There are some centers in Nigeria that have excelled in looking after them. The University of Ife is one of them, but they're relatively easy to manage. It's just that we don't pick it up early. Unfortunately, most children's illnesses, they get treated for malaria first before anything else, and then they start to dig deeper, by which time it has gone to a later stage. And then, of course, the population the majority of our population reside in the rural areas where access to healthcare is really not as good as it should be.
Okay, how important is our environment to cancer prevention? Looking at environmental pollution, illegal mining, deforestation, and other things happening, especially in the Northwest.
I'm sorry, I missed the beginning of the question. All I heard was environmental pollution.
Yes, I was talking about, I said, how important is our environment to cancer prevention, looking at environmental pollution, illegal mining, deforestation, and some other...
Excellent question. Yes. Excellent question. I like that. Climate change is a reality that we're facing, and also environmental pollution is one of the biggest causes of climate change. And that same environmental pollution, toxins in our environment, we litter our environments with things that we shouldn't, so that biodegradation is poor, and we have all sorts of chemicals released from industrialization. Mining, whether it is illegal or legal or illegal, produces a lot of toxins. There is a particular area in Kebbi State where mining activity is high. I have also personally witnessed a higher rate of cancers from that area. And we all know that even in Zamfara, the areas, some of the areas where we have problems are areas where there's a lot of illegal mining going on, and the children get, or even adults tend to get poisoned. So it has an effect, and it's one of the reasons why we are seeing an increased incidence. The presenter before in the earlier clip mentioned about 72,000 cases, deaths annually, and about 102. Those are actually figures from about 3-4 years ago. The current last year, according to GlobalCan, which is 2020, these figures have risen. We're now looking at 128,000 cases detected, with about 78,000 deaths annually from cancer. And like you rightly said, Babajide, the majority of the deaths of cancer in the last, or the occurrence and the deaths from cancer has been in Africa. In the last 20 years, it has doubled, and we're expecting to see another doubling before the year 2030. So these are all the kind of things that is causing us to see a higher incidence. Our children are eating more refined foods. We're using antibiotics more. Our natural immunity is being depleted. Cancer is a very fine balance of the gene with your immune system. Some of the new drugs are playing on the immune system. So once that is not balanced properly, you will see that there is an increase to the negative of cancers and such illnesses. The cells just go crazy. They're not able to control themselves properly, and the normal regulation is disrupted by all these things. So it is a problem. And then we have other things like COVID last year saw us with an unprecedented pandemic that the world has never seen. This affected all our cancer screening services, our cancer treatments. There were only 1 or 2 hospitals in Nigeria that were able to continue delivering cancer care. And it also brought to light the inequities that exist between us and the high-income countries. Just as we saw with the COVID vaccine, there are a lot of gaps when it comes to cancer care. There is a cancer that we can eliminate, which is the second commonest cancer in women globally. That is cervical cancer. There is a vaccine against cervical cancer, which is the HPV vaccine, is against the human papilloma virus, that is the most common causative agent of cervical cancer in women. However, this vaccine is not readily available to women in Nigeria and most other African countries because of the cost and because of the, it's not available. There is a long waiting list, and the Western and industrialized higher income countries have the wherewithal to buy it at the higher price, where we have to go through systems and so on that gives us at a lower price, and it's just not available to our girls. Meanwhile, in the other countries, even boys have started receiving HPV vaccine.
Sam, you have a question?
Yes, I do. Your initiative has come highly commended, and the figures that you have shared, are comforting in terms of the impact which you have shared, with Nigerians who are watching and listening. But there is also a concern, Madam, that programs, of the sort that you have initiated sometimes don't get to outlive those who have initiated them. What are the concerns? What would you like to speak to this issue? What are the guarantees that this initiative of yours is going to outlive you after you leave office as First Lady of Kebbi State?
Well, I didn't start the Medicaid Cancer Foundation as the First Lady of Kebbi State. I started it as the wife of Atiku Bagudu. I started it as Dr. Zainab Shinkafi Bagudu. He wasn't even in the Senate then, and he certainly wasn't the governor of Kebbi State. Like I said, it's a foundation that I started out of the need of our people, and it has grown. Today we were awarded an award by the Federal Ministry of Health as the best cancer NGO in Nigeria. I am a board member of the Union for International Cancer Control, which has nothing to do with my political affiliations or platform. And we do an enormous amount of work. The clips that you've shown from the Walk Away Cancer happened in Abuja, not in Kebi. And the reason we do that is to show that we are a national and a global organization. And our aim is to reach every Nigerian and also to make it sustainable. Okay, we do some work in Kebi. What if we were to concentrate all our work in Kebi? What will happen? That is why it will not be sustainable, because another government will come. I will not have that platform again. Even if they are very friendly, there are ways in which I will not be able to operate. So at no time did we base our work plans on Kebi. I will not deny the fact that it has been an enormous amount of support, and His Excellency in particular has been very supportive of our initiatives. In the States, I think we are the most advanced when it comes to cancer control. We have been able to do so much. I won't even, just to mention a few, we have a costed state cancer control plan. We have our own oncology units. We've been able to employ for the first time oncologists in the States. There is an indigent cancer fund, which is contributed to by the state governments and high net worth individuals. There are cancer registries, which is looking at the data in the state and trying to get better statistics out of it. And then also, there's so much that goes on there. We have outreaches that go on in all the rural villages. So that on its own, they have been able to achieve all those things because of the support and the work that the Medicaid Cancer Foundation does, with support, of course, from the government.
All right.
But I'm sure that I'll be here talking to you. How long is this term? Another 2 years, 1.5, 2 years.
Okay, let me quickly ask you this last question. Let me quickly ask you this last question. As a country now, what steps can be taken to achieve the global target of reducing cancer by 25% by the year 2025?
Well, one of the major steps that we need to take is to urgently institutionalize a screening service. The way we can get to this target is to detect earlier. We cannot detect earlier if we're not screening. And we have primary healthcare centers well distributed across our country. What we need to do, which we have been able to do in some of our PHCs in Kebi, is to make sure that there's screening. We also need to hike up our awareness. Awareness is such a low-hanging fruit. The typical narrative of, it's the devil's disease is something from, strange. You go to church, you go to the Babalawo, you go to the Malam and take concussions. We have to try to change the mindset of our people in the rural areas. And this is one of the advantages that I have found. And then after awareness, the next thing, of course, is funding. I have mentioned this. The National Health Insurance Scheme of Nigeria needs to clearly tell us what kind of cancer treatment is included in the scheme. Yes. The basic healthcare packages should include basic screening and treatment for cancers. Right now, there's a lot of, we're not sure, maybe, maybe not, and there's some that it will cover, there's some packages that it won't cover. But as an urgent need, all Nigerians that have health insurance, the national health insurance, need to be protected and covered for cancer.
All right, and that's a fine place to leave it. Dr. Zainab Shinkafi Bagudu, wife of the Kebbi State Governor and founder Medicaid Cancer Foundation. We appreciate your time with us and Journalist Hangout this evening.
Thank you so much.
Thank you for having me.
And good luck.
Well done.
Thank you for acquitting yourself competently.
Well, that's about it on today's edition of Journalist Hangout. Join us again tomorrow for another episode of the program. You can watch a repeat broadcast of the episode tonight at 11. Don't forget to join us on Sunday from 1:30 to 3:30 p.m. That's on Journalist Hangout. We are also on YouTube at youtube.com/TVC News Nigeria. I'd like to thank my guests in the studio, Babajide Kolade Otitoju. Thank you very much for your insights.
Thank you, my uncle, for your insight.
And of course, Sam.
Always my pleasure.
Thank you so much.
Thank you.
Well, I remain yours truly, Esther Bakwariola. Many thanks for watching. Bye for now, and God bless Nigeria.